Hello, my name is Daniel Campbell. I'm a physician assistant student at Nova Southeastern University, and today we're going to talk about glucose-6-phosphate dehydrogenase deficiency. Now, chances are, if you're watching this YouTube video, you have gathered one of the pamphlets or one of the flyers that you probably saw in the doctor's office. And so I want to thank you so much for joining us. And this video is designed to augment the pamphlets or the flyer and go more into depth about glucose-6-phosphate dehydrogenase deficiency. Now, in the pamphlet, one of the sections talks about oxidative damage affecting your red blood cells. So we're going to go into a little bit more detail about that. So glucose-6-phosphate dehydrogenase is actually an enzyme that helps maintain levels of a substance called glutathione. Now, glutathione is known as a powerful antioxidant that actually helps protect your body from oxidative damage. Oxidative damage being something like infection. So if you were to have the common flu or a virus that would cause, a widespread infection throughout your body, that causes oxidation, as well as a lot of the medicines and chemicals listed in one side of the pamphlet. But also later in this video, we'll go over the different chemicals and different medicines that are notorious exacerbators of glucose-6-phosphate dehydrogenase deficiency. So kind of going back to glutathione being the powerful antioxidant, it protects your body, primarily your red blood cells, from oxidative damage. Now, oxidation is a good thing. Without it, we wouldn't have fireworks, we wouldn't have combustion engines, and life, as we know on this planet, wouldn't really exist without oxidation. However, too much of a good thing can be bad, or too much of a good thing in a bad situation can be terrible. Now, being that this disorder is a deficiency of glucose-6-phosphate dehydrogenase, that means the levels of glutathione are not going to be as high as they should. Now, that is where the problem really occurs, because you're having oxidative damage build up, or oxidative processes build up in your body. So say you're infected, you have a common bacteria, cold, and then you're exposed to one of the chemicals that we're going to go over a little bit later. That oxidation is building up. Normally, glutathione would help protect you, but because there's a deficiency, you don't have enough glutathione, and that is where damage actually occurs. So what do we really mean by damage? Now, there's two types of damage that are really kind of pronounced with your red blood cells. One of them is the actual lifespan of your red blood cell. So red blood cells are used throughout your body to carry oxygen. You can kind of imagine a donut that without the hole missing. It's almost like a bowl shaped on both sides, if you can imagine that. Now, whenever your red blood cell lives shorter, they don't really mature, and a mature red blood cell carries more oxygen. So if you have red blood cells that are dying and being filtered a lot sooner than they should be, then you're not going to have the amount of oxygen carried around as efficiently as it should, and that's what very often leads to the shortness of breath and the fatigue, because you need oxygen throughout your body in order to keep up with respiration, as well as put the oxygen into your muscles. Now, oxidative damage will also cause your red blood cells to be misshapen and actually split apart, and that's where the word hemolytic comes from. And you'll probably see that very often going through literature. You'll see hemolytic anemia. Now, you can kind of go back to our donut analogy. You can imagine that donut, and there's a slice taken out of the donut. If you were to try and carry something on that donut, it wouldn't work as well. So oxygen literally is not being carried as efficiently, leading to increased fatigue, tiredness, lethargy, and among the other symptoms. And these red blood cells that are misshapen will also be picked up sooner by your spleen or your liver, which naturally filter your red blood cells. And by removing those red blood cells, you lose more of your taxi drivers, your oxygen taxi drivers per se. So one may ask, does this happen to all of my red blood cells? Are all of my red blood cells affected? And the answer to that is no. And that is one of the major reasons why a lot of individuals with glucose-6-phosphate dehydrogenase deficiency are asymptomatic or do not have any symptoms at all, because their body is able to compensate for this. And one of the ways that it does that is by a process called erythropoiesis. Now, erythropoiesis is your kidneys sending out a chemical to your bone marrow saying, hey, we need more red blood cells. And so your bone marrow, by increasing, the amount of red blood cells you have in your body, you're not going to have the symptoms of glucose-6-phosphate dehydrogenase deficiency because your body is, again, compensating for that. Going through the pamphlet, we never really address how glucose-6-phosphate dehydrogenase deficiency is classified. Now, the way it is classified is, and we all typically use the World Health Organization's classification, the WHO. There's 5 different classes of that, 1 and 2 being the most severe, and 4 and 5 being the least severe. Now, 5 is classified as decreased enzymatic activity, and so that's talking about glucose-6-phosphate dehydrogenase, and there are no clinical sequelae in 5 or 4. Now, sequelae is one of the fancy medical words that we coined to talk about long-term effects, and these are usually deleterious effects. 1 and 2 class are the most severe. So this is where there's a severe deficiency and you have less than 10% activity of the glucose-6-phosphate dehydrogenase. Those classified in the class 1 and 2 category will have chronic hemolytic anemia, that word that we mentioned earlier, and will often struggle with and have the most symptoms present. Briefly mentioned in the pamphlet is how glucose-6-phosphate dehydrogenase is passed down genetically. So it is X-linked recessive. It's an X-linked recessive trait. So what do we mean by X-linked recessive? Reading through the pamphlet, it explains to you how a mother donates an X and a father donates a Y if a son is made from the family as an offspring. Daughters are XX. And so that is typically, it's going to be an X from the mother and an X from the father. Now, glucose-6-phosphate dehydrogenase deficiency is X-linked. That means the actual disorder is connected to the X chromosome. And now chromosomes are genetic information, DNA passed from mom and dad to the offspring. So I wanted to bring up a unique situation that exemplifies why genetic testing is important for glucose-6-phosphate dehydrogenase deficiency. Let's use the instance of an affected father, which is very common. This is quite a common deficiency. 12% of African American males in the U.S. are affected, and some 20 some odd percent of females of African American females are carriers. And carrier is essentially, remember how we just mentioned that females have 2 X's. One of the X's is affected. However, the female doesn't express or doesn't show symptoms because she has another X that is available as a backup, and that's also mentioned in the pamphlet. So the situation that I wanted to talk about is where an affected father meets and mates with a carrier mother. Now, because it is X-linked, the mother, 2 X's, one of her X's is affected with the genetic disorder. Now, the father, we mentioned that males have an X and a Y. The father, his X, his only X, is also affected. And that means that if this couple were to have a son, the father will give the son his Y and the mother will give the son her X. The chances of having an affected son is 50%. Likewise, the chances of having an unaffected son is also 50%. Now, daughters, there is essentially a 50% chance you're going to have a truly affected daughter, and that it would be an instance where the mother passes on her affected X and the father passes on his affected X. Or you could have a carrier daughter where one of her X's is affected, and that would be where the mother gave the daughter the unaffected X. Remember, the females have the 2 X's. So that's a unique situation that could very likely happen because women who are carriers who one of their X's is affected may be very asymptomatic. However, they might have had an instance where they're exposed to one of the chemicals and they had a bit of a flare-up, if you will, and that would be that alone right there might warrant enough cause to be genetically tested for this if it is known that the individual that she chooses to mate with is an affected male, and that would be quite evident due to the symptoms, unless he is asymptomatic. So as that couple went throughout and became and got tested, genetic testing and whatnot, they might arrive to the situation where they're most curious about their offspring. Now, we just went through what the situations will be like if they were to have offspring, but are there any possible genetic tests that this couple could partake in to find out if their children will be born with the disease or born without the disease? And as of right now, there are no particular genetic tests that can be performed in vitro to find out if the child is affected. However, there is umbilical cord testing when the child is born. Blood will be taken from the umbilical cord to find and tested to see if the child is affected. Now, I wanted to take a second to go a little bit deeper into the triggers. Now, on the pamphlet, it lists a long list of the triggers. However, it doesn't quite go into detail. Now, fava beans, you would look at and think, wow, okay, what is this bean? What is special about this bean? And this bean is special for this particular disorder. And I wanted to talk more about different names of fava beans. So broad bean, fava bean, field bean, English bean, horse bean, Windsor bean, pigeon bean, and tick bean. These are all beans, bean names that you could find in the grocery store, and if you were affected by glucose-6-phosphate dehydrogenase, you might not know. You might only be looking for fava beans. And so in that case, use those names that were just mentioned while shopping for fava beans. Now, one of the medicines mentioned that can cause an exacerbation of glucose-6-phosphate dehydrogenase is aspirin. Now, aspirin is often utilized for its antiplatelet properties, but it can cause oxidative stress to the body and in any capacity, whether you're taking an 81 milligram or a 325 milligram for its antiplatelet heart protective properties. Dapsone is an antibiotic typically used for leprosy. However, it's also used for acne. And one of its side effects is breaking down of red blood cells. And so we as we've learned through this video and go through the pamphlet, that is one thing that is happening with glucose-6-phosphate dehydrogenase deficiency, is breaking down of those red blood cells. Certain glaucoma medicines, such as Truops. Now, there are two other ones mentioned, Azop and Diamox pills. If you know that you have glucose-6-phosphate dehydrogenase deficiency, this is something that you would want to mention to your primary care physician if he does mention to you that he needs to put you on glaucoma medicines. These are 3 particular medicines that you will want to completely avoid. Now, Primaquine is a unique medicine, and that is used to treat malaria. Now, mentioned in the pamphlet is that glucose-6-phosphate dehydrogenase deficiency and malaria very often go hand in hand as far as its demographic, spread. So this medication should stand out to us because it's going to be used in areas where the malaria is most common, and through extended research you can find out that malaria is a parasite that is transmitted through the vector of mosquitoes, and it can actually live on the red blood cells. Phenazopridine and nitrofurantoin are often used for urinary tract infections, and so if you were to ever present with a urinary tract infection, and that kind of comes to your mind whenever your doctor is talking to you about whatever that condition, then that might want to pop up in your head, something to mention to the physician. And methylene blue. Methylene blue is a unique compound that has a sundry of practicalities both in the hospital and outside of the hospital, outside of the medical field entirely. And something unique that you can do is if you do have glucose-6-phosphate dehydrogenase deficiency, you should mention to your physician, to the admitting physician, that methylene blue should honestly and truly be labeled as an allergen, because in a sense it really is. It's going to cause negative effects if that medicine was to be chosen to use for you during your plan of care. Chemicals. Aniline dyes are also wood staining dyes. So if you're a woodworker or a carver and you very often stain wood, look out for that particular chemical. Naphthalene is a mothball repellent in a toilet bowl deodorizer. Something that you might have never thought about that could actually cause an exacerbation of the glucose-6-phosphate dehydrogenase deficiency. And henna tattoos. The compound, the ink inside of the actual henna is could cause enough oxidation that you'll break up those red blood cells and you'll cause a reaction, and you might result in that hemolytic anemia, resulting in your symptoms. Now, it's very important. We've gone over a little bit about the actual oxidative damage, what it means, what's quite literally happening to your red blood cells. We've gone over a little bit of the genetic, how it's X-linked, and then we briefly went through some of the chemicals and how these chemicals are used, and how you can stay educated and empowered to know when they might be applied and where they are throughout life. It is important to note that the diagnosis of glucose-6-phosphate dehydrogenase deficiency should be made by a physician. The pamphlet discusses different ways, different tests utilized to discover this disorder, but it should also be known that it should be expressed and duly noted that whenever you're experiencing the symptoms of glucose-6-phosphate dehydrogenase deficiency, that is not the point when you want to pursue testing to see if you have it. It might kind of sound contraindicated contradictory because, hey, I have these symptoms, I should get tested right now. That's whenever I'm going to find this out. However, the symptoms will actually mask the markers that are looked for in your blood work. So you'll have to work with your physician. It should definitely be on a differential diagnosis list. It should be up there if you do present with those symptoms. But again, that diagnosis needs to be made by a physician that does proper blood work. I want to thank you for joining me through this YouTube video about going a little bit deeper into the glucose-6-phosphate dehydrogenase deficiency. If you have not picked up a pamphlet, you can contact the doctor's office and we can mail you a pamphlet or a flyer should you please. And thank you and have a nice day. If you want, leave comments down below. And we will learn from those compliments, and we will appreciate them greatly. Thank you so much for your time. Goodbye.